There are different types of hormones and they play a different role in the different phases of the IVF. The first group of hormones that we use are those hormones that are going to stimulate the ovaries, mainly FSH or HMG. These kind of drugs are going to work in the ovaries and they are going to make grow more than the single follicle that the woman produces in a natural cycle. And these drugs are usually taken as subcutaneous injections. We are also going to have hormones that are going to block the natural ovulation of the woman. These kind of drugs are two different types, the GnRH agonist or the GnRH antagonist. The drugs are taken as well subcutaneously and they are designed to block the natural ovulation and to let us decide when we want to trigger the ovulation. And usually these two drugs, the gonadotrophins that are going to stimulate the ovaries and the antagonists or agonists are going to take together for a few days. And whenever the patient is ready for the collection, we are going to use a third type of drug called HCG, which is going to be used to trigger the ovulation. Okay? Then after the collection, we are going to use the fourth type of drug, which is the progesterone. And the main role of the progesterone is to open the implantation window and lead to the necessary changes in the endometrium that will allow the embryo implantation. The progesterone can be taken either in vaginal pessaries, oral pills, subcutaneous injections, or intramuscular injections. We mainly work with vaginal pessaries because they are quite easy to take and the effects are more than enough. But in some cases in which the levels of progesterone are not good, we may recommend taking subcutaneous injections of progesterone or simply add them to the vaginal pessaries that the patients are already taking.